From the discussion post on Blackboard, out of the 14 people, 3 said they smoked and 1 occasionally smokes. Therefore, 10 do not smoke. But almost everyone knew the side effects of smoking, so why haven't the smokers quit? Smoking causes many effects on your body and is not considered desirable. I personally do not smoke, nor have I ever tried it or want to. I'm going to talk about the causes of nicotine effects on the body's systems, secondhand smoke, withdrawal symptoms, and treatment options. Let's first start off with the effects nicotine has on the body's systems. From my pharmacology and nursing process book, I found out the effects on the body's systems. So first, I'm going to start off on the causes on the cardiac and vascular systems, which include vasoconstriction, meaning your blood vessels get smaller, increasing the rate at which your blood flows, therefore causing tachycardia, which is abnormally rapid heartbeat. It increases cardiac contractile force, making the heart pump faster. It can contribute to hypertension, which is high blood pressure. This leads to vascular diseases and damage to heart, brain stroke, basically making your heart pump faster and work harder than it needs to. And as we can see here, it says all that. Increase or decrease heart rate, increase blood pressure, tachycardia, and some other ones. Now I'm going to move on to the GI and urinary system, which is over here. So the GI, urinary, and exocrine glands affect our increased secretions from mucus, gastric, salivary, and sweat glands. They can cause diarrhea, increased urination, nausea, vomiting. Most likely you get bladder cancer from this. Now the respiratory effects include smoke irritation to cells because of the tar, the cilia, which is a tiny protections that move back and forth, but they can't move because of the tar. Therefore, you get lung cancer. And here it says lungs, bronchospasms. Skeletal muscle effects are things such as muscle tremors, which is twitching of the muscles, and that's why sometimes smokers seem anxious. And we have here muscle tremor and pain. Now moving on to the central nervous system. So the central nervous system effects increases risk in pregnant women to deliver low birth weight babies because nicotine crosses the placenta barrier and passes through breast milk, which causes effects in infants. So it's best to not be smoking while pregnant or while you're breastfeeding. Childhood effects are things like psychological adult effects and adverse effects on growth and general health. So in addition to nicotine affecting your body systems, it also affects others by secondhand smoke. From an article on nicotine addiction and withdrawal secondhand smoke from the New York Times Health, I found a statistic that estimated that 4 billion children a year get sick from being around secondhand smoke. So if you are a parent, you shouldn't be smoking around infants because they could develop an abnormal lung function that could carry out through the rest of their life. Also, by smoking in your home increases risk for asthma for people exposed to secondhand smoke. Now that I got your attention, let's turn our attention to the withdrawal symptoms of nicotine. Nicotine is the most potent and toxic drug known, so the withdrawal symptoms are not pretty. So from an article in Public Med Health, they talked about nicotine addiction and withdrawal. The symptoms of nicotine withdrawal, according to the article, start 2 hours after your last tobacco use and can reach its high 2 to 3 days later. It also depends on how long you smoked, and the amount you smoked. Common symptoms include intense craving for nicotine, anxiety, tension, restlessness, frustration or impatience, difficulty concentrating, drowsiness, or trouble sleeping, as well as bad dreams and nightmares. Headaches, increased appetite, and weight gain, or irritability or depression. Therefore, I am now going to talk about the treatment options available to help you quit. I like to call it nicotine without the talk. There are many medicines containing the same active ingredient, nicotine, but I am just going to briefly talk about one, the nicotine patch. I got this information from the UK's leading independent health website, and basically it contains nicotine, but a small amount without the dangerous effects of inhaling tobacco smoke. So you're still having the active ingredient nicotine, but without the smoke. It helps to relieve withdrawal symptoms and craving for a cigarette. If you are physically addicted to nicotine, it almost doubles your chances of successfully quitting smoking. It works by absorbing through the skin, and throughout the weeks you decrease the strength of the nicotine, so that way throughout the weeks you won't need as much nicotine, and hopefully your body then will be able to not have that craving. But you need to remember that since it is absorbed through the skin, you want to make sure that you do not put it on any broken skin, or if you're exercising, this can increase the effects of the nicotine. So of course there are a lot of side effects, the same as smoking, but is without the tar. In summary, nicotine causes a lot of harmful effects on the body and is not desirable. Smoking causes many effects on your body and is not considered desirable. Therefore, remember these main points. Nicotine affects the body systems, effects of secondhand smoke, withdrawal symptoms, and treatment options. All drugs have side effects, and everyone will someday die from something. But I think there are better choices than smoking. In the long run, smoking will do more harm. Better to quit now before it's too late.